I'm Faye Watt, and let's queer up trans rights. Federal prosecutors seek NYU Langone records on trans youth gender-affirming care. The U.S. Attorney's Office for the Northern District of Texas has issued a subpoena seeking medical records of transgender youth who have received gender-affirming care at NYU Langone Health since 2020. NYU Langone notified patients of the grand jury subpoena, mentioning that it is one of several health institutions to receive it. Under New York's SHIELD law, hospitals are required to notify patients when requests involve legally protected health records, including those related to gender-affirming care. The subpoena also requested the names of providers at the hospital who deliver gender-affirming care to youth. NYU Langone hasn't said if it will hand over the records. The subpoena comes amid President Donald Trump's effort to reduce access to gender-affirming care for minors. Earlier this year, a federal court blocked the Justice Department from accessing similar records from a Washington, D.C. area provider. Tyler Hack, founder of the Christopher Street Project, suggested the Texas filing could be an example of judge shopping. Quote, "They're using every law at their disposal to attack trans kids, distort the rules, and change the game to seek a favorable ruling because they're not winning on merit," end quote. NYU Langone's gender-affirming care program has been under the spotlight for months. They halted gender-affirming care for trans youth after the Trump administration threatened to pull federal funding. Even after a federal court blocked that effort, the hospital did not say whether services would resume. You know, medical records are supposed to be private, not a scavenger hunt for politicians obsessed with trans kids. At this point, they're spending more time policing pronouns than fixing healthcare. And that really is the real diagnosis right there from my seat.
Yes, absolutely. Well, they're creating lists. They're creating lists of others. They want to get a list of kids who are trans. And believe me, that list will follow them the rest of their lives if these fascists have their way. They're creating lists of doctors who are daring to be so bold as to give health care to kids who need it and adults who need it. Last year, I remember the Trump administration wanted campuses to submit lists of all of their Jewish students so that they could make sure that they were protected on campus. And we know that as much as this administration claims to be pro-Israel, there are just as many anti-Semites who are targeting our Jewish brothers and sisters. This is vile. There is more to it than just looking into it. This is a part of a long-term plan, and we need to stop it in its infancy. We need to stop it right now.
This goes far beyond just the transgendered issue. It's any kind of medical records. If the government can just subpoena them, they can target anybody they want to, including insurance companies. Who knows if this administration is going to stay in power for quite some time, and they're redoing their healthcare systems, and they're like, oh, well, we're going to strip Obamacare, we're going to strip all those protections of pre-existing conditions. So if they have your medical records and they can see any kind of pre-existing condition you have, they can use that for all sorts of reasons to deny you coverage or, in the future. So anybody, whether you care about the trans issue or not, you should definitely care about the issue of the government being able to access any kind of patient health records in hospitals.
There were rumors in Miami-Dade County that they wanted them to hand over medical records of anybody who was undocumented.
Yes.
Okay, this is the world that we're living in right now, and that's so utterly scary.
Yeah. I mean, I made this comment last week, and I stand by it again. This is not about anything that we're talking about. It's all about power, and it unfortunately puts places like this hospital. They said they stopped doing the care because they were going to lose funding for other things. So that is the government pulling power, saying, "I'm going to say this and make you make a Sophie's choice. You either help the 1% or you help the 99% of the rest of the people in your hospital." So all of these things that are happening has nothing to do with the thing that they're going after. They're going after the smallest thing to say, now we have power over you. And, to your point, it's not just about these records. This sets merit. This case then can be used in any other case to get what they want. So it's always and has always been and still is about power and them trying to exude power to show that we are the powerful people. We are the president. We are the government.
And to your point about the power is that even if the hospital realizes that this is unconstitutional and that we would win in a court case, they know that this administration likes to drag things out for months. So just the delay of getting the funds, even if they know that they're going to get it, is still enough to just comply with whatever
Exactly.
they
Do
want
I help
to.
you or do I help you?
Well, and how about all those kids and all those people that were getting gender affirming care
Correct.
from there and no longer are
Correct.
getting that? You know
Yeah.
what I mean? The Trevor Report tells us that all the time that 9 out of 10 trans kids think about ending their lives, you know, and that
Right.
gender affirming care helps with that. you
And it's
know?
worth noting that this is so anti-Republican. Like Republican, like platform is like small government. That the government is not in your business. So the fact that they're
In your business.
exactly when one of the largest overreaches that it should be that the conservative and Republican platform is that any medical issue that you're dealing with is between you, your family, and your doctor,
100.
and the medical boards that are, you know, you don't need the federal government to step in. Every doctor has to be licensed. There's whole levels of
That's why
bureaucracy
HIPAA
before
laws
they're
exist,
Right.
you know?
Yeah.
And
Exactly.
Like I said, it has everything to do with power. They're going after the smallest section and threatening with really large sanctions. I'm not going to give you funding on X, Y, and Z if you still do this one thing that deals with 1%. And the hospital has to make the choice. Do I sacrifice 99% of my patients for the 1%? And it's sad to think that way, but that's what these companies and organizations and hospitals are being forced to do.
Yeah.
Well, there is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by sharing them and subscribing to Queer News Tonight.